way, you got them here, fire your quad. See how she can come up off the table like that? In rehab, that is awesome right there. She is probably getting 0 degrees, okay? She might even have a little 0 to a -5, okay? Some people, I notice we have a point guard on our team. For whatever reason, when he gets up there, he's got some genu recurvatum. Because whenever he makes his leg go straight like this, I feel like his toes are in my face. I'm like, what is he doing different than everybody else? And I was finally, the other day, I was like, he must have unbelievable recurvatum in his knees. Anyway. So, 0 to a -5. So I have them do a quad set and see if they can lift. That's one way to assess. If I'm in the process of looking at it, I can also pull up on this just like that. Okay, so I'm looking at them in full extension. Flexion, there's a number of different ways that we can do that. If we have her slide this way, just a little. Now lay back. Okay, so I can bring her up here, and I want to try and get heel to her butt. Now, let's say I'm going to compare it to the other side. We got this one here, and she's had surgery. So she's got her toes up like this. See our difference here? So we obviously want to get that down lower. Okay, so we can get that down. We can look at her flexion in this position like this. Now she's going to flip over on her stomach. If we're going to goniometric measure this, I'm going to see if I can get heel to butt. In rehab a lot, I'm going to go like this because I'm going to get her here. I want to get her to relax, and then I'm just going to do some low load, long duration little holds right here. Have them relax, get their hamstrings nice and relaxed. They're not going to want to get there, right? They're not going to like it. And so I can look at them in that flex position. If they're getting there just fine, I might not even do any pushes. We rehabbed an ACL, one of the staff members, and she just does great. It was an isolated ACL, so there wasn't a whole lot of other things to worry about. So what you'll do, go ahead and flip back over, in lab is we're going to look at goniometric measurement for full extension. So how would I do that? Is I'm going to use my, my joint line as my fulcrum. My stationary arm is going to be femur, and then we'll look at the tibia as the movement arm. Okay? So we'll be able to see how much they get, and we'll put a measure to that. How do I differentiate between these? Now, when we get to the hip, I'm going to have her lay back. My rectus femoris, I'm going to do a straight leg raise for her, okay? And for my psoas, I'm going to bend her up here at 90-90 and push just like that. So if I'm looking at the knee, when I'm going through real time, go ahead and rest here. I'm probably going to put her, I want her in a supine position so she's in the best position to look at this. She's going to do a quad set and then lift it straight up off the table. Boom, just like that. So a quad set, straight leg raise for knee, okay? My VMO, one of the best ways is that quad set. So in this position, I can have her do a quad set here, nice and tight. What's another way I can look at that? Off the table, leg extension. So if I'm doing rehab with her, she's gonna scoot off the edge. And I love doing short arc quads. They say not to do leg extensions because of the shear, it's on the ACL graph. But when you're doing things in rehab, now sitting in a hamstring or a leg extension machine in the clinics is okay, but I like to put the bar a little bit higher where it's not, the closer you get to the knee, now you can't put it right here, but the closer you get to the knee, the less shear on the ACL. But if I've got it way down here and she's pushing, I'm gonna get some, translation, some glide of that tibia. So, but if I'm just putting a bag weight on here, right? I have her can do leg extensions, some short arc quads like that. But one way for me, I like to always take that out. I'm going to work in the concentric or the eccentric? Eccentric. So I get her to take her foot, put it underneath her heel here. She can fire a little bit, but she's going to use her other leg to get up there. Pull that toe back, nice and tight, take that foot off. And then she's going to lower 1,001, 1,002, 1,003. We do a lot of correctives like this, working on the eccentric in the open chain. So she's going to put the foot back underneath, get it up there, nice and tight, toes back, nice and tight, take the foot off. The other thing I'll have them do is to roll their leg here and then just do a straight leg raise for me, just like that. If I can work these adductors, I can get a little bit more to my VMO. Okay, that's another little tricks that you can do. Okay, but that is one way that I can also look at a VMO, VLO. Okay. The difference between my biceps femoris and my semi-T. She's going to flip over. So if I'm working, and I got to go ahead and bend to a 90 for me. So if I'm working on this side of the knee, I got which two muscles? Right? And then I've got my biceps femoris out here. I just like to think of it as I'm going to point her foot in the direction that I want to fire that muscle. Okay? So I'm going to turn her toe towards the biceps femoris. She holds, and then I would palpate. I'm going to turn her foot medially and hold, and palpate. Okay? So that's how I want you doing the MMTs for that. Go ahead and flip over. Now, did we go through all of the palpations? I believe we did.
Yes.
And so, let's start looking at some of our exams. Okay? Now, what we're going to do is we're going to spend the next about 10 minutes, we're going to practice the modified Lachman's anterior slocum drawers and posterior drawer. Okay, maybe. Whose is this? Okay, so we're going to practice. Now, the Lachman's, remember, in the pictures, they always had their foot straight up like this. You can get a better exam, roll your legs out. When you sleep at night, who sleeps in here with their feet straight up like that? Don't answer because it's going to be crazy. You sleep in a casket or something. Okay, so you can roll your feet out like that. So we want to put them in this position like this. We want to have them out here like that. They'd put a roll underneath there. All you got to do is slide your leg underneath here like this. Get them to externally rotate a little bit. You've got them here like that. I'm going to place my hand up here. I'm going to take her tibia and pull it straight forward like that. Okay? Now, you're not fighting with it. You just got them right here. Get through the muscle a little bit. Feel onto the bone there. Bang. And you're just pulling straight forward like that. Okay? Just that easy. All right? Now, when I do an anterior drawer, I bend her up here. I've got her at 45. I've got her at 90. I sit on her toe like this, barely sitting on the foot. I put my hand around here on the gastroc. My other two fingers go on the tibial plateau. This is my tibial plateau, right? Right there. And I'm going to go right there, and I'm just going to pull straight forward like that. And then to do a posterior drawer, I just push straight back like that. Okay? Anterior, posterior, just like that. A nice firm pull. Push posterior. Now, if I'm going to do my slocum drawer, I put her into internal rotation. I expose this whole lateral side, right? And so I'm going to pull like this. If I want to do the medial, I externally rotate that foot. And my angle of pull isn't that way. It's straight forward again. Okay? So I'm going to pull straight forward like that. Same thing if I'm turning her into internal rotation. So that is modified Lachman's anterior drawer, posterior drawer, and then I got my slocums in there. Okay? So get with your partner and let's do it.